Warm welcome to today's talk. It's Thursday the 4th of November. Now, today I want to be talking about booster doses. Now, it's very disappointing, to be quite honest, that the longevity of the immunity generated by the standard 2-shot dose, or in the case of the Janssen, Johnson & Johnson vaccine, the single-shot dose, has been as short as it is. So as a result of this, quite a few countries are now embarking on a third dose, a booster dose, or a second dose in the case of the Johnson and Janssen vaccine. Now, which countries are these? Let's just start off with that. Before we do that, we'll just say that the booster doses do seem to be very efficacious, and the safety profile is looking about the same as it is after the second dose. So that seems to be the kind of bottom line in the official figures that we're getting at the moment. But let's look at who's embarked on this first of all. And here we see COVID-19 vaccine booster doses administered per 100 people. So these are essentially percentages. Now, Israel, we notice, is about 45%. So Israel's leading the way on this. Now, Israel led the way with the initial doses of the vaccine, of course. But the strange thing about Israel was it's now fallen down quite a lot in the sort of league table of vaccinations because a lot of people haven't taken the vaccine up. But now we see quite a few of the people that had the 2 doses already taking up the booster dose. Interestingly, Uruguay and Chile come after that. I hadn't guessed that. That is interesting. Then the United Arab Emirates, which isn't really surprising. And then we have a sort of a string of countries after that in order. Turkey, Singapore, United Kingdom, United States here. So these are the lines for, I think that's the United Kingdom there in green, for example. And the United States, I believe, is that one there in pink. So it's quite a lot lower. It is per capita, of course. Then France, Brazil, Thailand, Italy, Germany, fairly low. Spain, Canada, Russia, very low. That's the world average there, of course, very low, of course. Iran and South Korea and Iran below the global average. So they're the countries that are embarking on this program at the moment. What is the evidence level for this, of course, is what we need to consider. And let's start off with this. So that was the Our World in Data thing there. So that was that. Now, United States so far has given 20.6 million booster doses. So it's well underway in the United States, although less than other countries, as we've seen. Now, here's the figures for the United States on which ones have been used so far. And I want that one. So, number of people with a booster dose in the United States by COVID vaccine type. So, Pfizer BNT, we see, is by far the most popular one. And of course, we now know that you can mix and match in the United States, basically upon request, we believe, in most places. Then the Moderna, and then the Johnson & Johnson Janssen vaccine, and unknown in quite a few cases as well. So that's the sort of stakes of vaccine popularity so far in the States, at least. Now, in the States, it's 6 months after the second shot, 65 years and older, or 50 to 64-year-olds with underlying medical conditions, which makes sense. Or it's 18 to 64-year-olds living and working in high-risk settings, institutions, primary healthcare providers, such people, care homes, and quite a bit of prisons as well, I believe, is considered a high-risk institutional setting. 18-year-olds and older, of course, it's not the 6-month gap, it's the 2 months. If someone's had the first dose of the Johnson & Johnson Janssen vaccine, where the level of protection, at least against symptomatic infection, the level of protection goes down fairly quickly, unfortunately, although the protection against hospitalisation and death remains higher, as we'll be seeing. Now, let's look at the data on this. So let's go to this first paper here. This is the first paper we want to look at, where we actually give the evidence. This is from the New England Journal of Medicine, fully peer-reviewed, detailed paper, fully downloadable, all readily available free of charge, which of course is excellent. So that's this paper here, protection of the vaccine against COVID-19 in Israel, and of course this is the Pfizer BioNTech vaccine, which was predominantly used in Israel. Now, 30th of July 2021, they started on the over 60s. Started vaccinating the over 60s with a third booster dose of Pfizer vaccine. That was when it was approved. This is to 60-year-olds and over who had been fully vaccinated. But then on August the 29th, they started vaccinating with a third dose, a booster dose, anyone over the age of 12 who'd had the vaccine at least 5 months previously. And so far they've collected data on 1,144,690 people. And that's what this paper is on. It's about this program in Israel, which of course, as we saw, was really quite a long way ahead. Now, this is quite an interesting study. There's 2 dynamic cohorts, because now what this means is, of course, people that have had 2 vaccines, quite a few of those people that have had 2 vaccines will get a third dose of the vaccine while the research study is running. So what they did was, rather than take individuals, they took vaccination days. So like if someone spent, say, 50 days in the 2 vaccine dose group, and then they were vaccinated, well, 12 days after that, they would join the booster dose. And if they had another 30 days in that, then they could actually be included in both cohorts, because it's vaccine days. And then they looked at the incidence of infection, severe infection and hospitalisation in those 2 groups. So quite clever, really, because as it's ongoing, people are moving from the 2 vaccine group into the booster group. So it's a dynamic examination on a daily basis. So quite a clever study, really. So one group was 2 vaccines only. That was one group, and they were compared against 2 vaccines plus a booster. That was the second group. So very nice. We have 2 groups, even though they were dynamic groups, it still gives us a rather nice comparison. Now what we find, the 5.2 million person days were in 2 vaccines group. In that 5.2 million person days, 4,439 people got symptomatic infection. 294 people got cases of severe COVID, but the actual severe one was based on 4.6 million person days. They didn't quite get the full number in. So we see that of all these person days, not too many, well, yeah, certainly some infections, but fewer people getting severely ill. But let's compare that to the 2 vaccine plus booster. Now this was over 10.6 million person days, and they didn't have 4,439 confirmed infections in the 2 vaccine plus booster group. They had 934. Pretty big reduction, to be quite honest. In the 2 vaccine group, remember, they had 294 severe cases of COVID. In the 2 vaccines plus the booster group, they didn't have 294, they had 29. So 10 times less, despite more person days being considered. So we see there, pretty conclusive really, that the booster dose of the vaccine, at least in the short term, how long is it going to go on for, of course we don't know yet, but at least in the short term we see good levels of protection against symptomatic disease and even higher levels of protection against severe disease, which of course is what we're really interested in. And of course the people that had 2 vaccines and the booster were those that had the vaccines first, and they tended to be the older demographic. So this was an older demographic than this one, on average, but still lower number of cases. 12 or more days after the booster dose, increased antibody neutralization antibodies were about 10 times what they were after the second dose. So roughly 10 times the number of neutralizing antibodies. Now, you and I both know that antibodies are by no means not the only part of the immune response. We need to know what's happening to the memory cells, the T cells and the B cells as well. This study simply didn't address that. But we do believe that they last for longer, the immunity lasts for longer. 11.3-fold decrease in the rate of confirmed infection. So there was 11 times less, not 11%, 11 times less. So 11.3-fold decrease in infections. And that took the efficacy amongst those that had the booster back up to where it was at the very beginning. It was about 95% compared to those unvaccinated. And the vaccines may have waned, say, 50% over time. Now, more exact figures on this from the UK data in a minute, but that's roughly where they were at. And if we assume that, then there's a 19.5-fold decrease in the relative risk of severe illness with a booster. In other words, people that have had the booster are nearly 20 times less likely to get severe illness than people that have only had 2 doses of vaccine. This is really quite impressive. Of course, the people with 2 doses of vaccine were already largely protected. But now we see that the people that had the booster as well, it's about 20 times more protected. Not 20%, 19.5, nearly 20 times decrease in the relative risk. When it says relative there, that means the people with the boosters relative to the people with only 2 vaccines. And this is another interesting graphic they had here. So this is reduction in confirmed infection rates up and down there, reduction in confirmed infection rates, and multiples. So that's like 10 times less infection, 20 times less infection, 30 times less infection along there. So pretty impressive reductions, and these are the number of days. So for example, at 12 days, it was, if it's exactly 12 days, then we're looking at about what, seven times less. But after 12 days, so for example here after 21 days there, we're looking at well, that one's just over 20% level of protect, not 20%, not 20%, not 20%, 20-fold times 20 less, 20 times less. So here we see that someone's 10 times less likely to get confirmed infection at the stage of about by 16 days. Certainly, they have 10 times less chance of getting infected. So either way, any way you look at it, this is impressive levels of protection, at least in the short term. How long will this last? We don't know. Now, I must say, I got it. I got it wrong, really. I thought immunity from these vaccines would last for longer than it is. It's waning quicker than I anticipated. But having said that, with a third dose, I would expect that to give much longer lasting immunity. Now, the UK government are saying to protect you over the winter, so that presumably means through to the spring of 2022. But I suspect it might be longer than that. So it may well be that a 4th dose is not needed for quite some time. That would be my hope. The conclusion from this study here, from the Israeli data, in conjunction with safety reports, this study demonstrates the effectiveness of a 3rd vaccine dose. Well, from that data, clearly it does, very much so. In both reducing transmission and severe disease, so as we said, reduced transmission, 11 to 20 times, depending on how many days, severe disease by 19.5 times. Not 19.5%, 19.5 times. Indicates the greater potential of curtailing the Delta variant resurgent by administering booster shots. That's actually the original. That's actually a quote from the original preprint paper that we did look at before on this channel. We did look at that preprint paper, and I said I've read through this, and it will be confirmed by peer review, and it has been. There is the confirmation. Having said that, some of the data on here is showing even greater efficacy against reinfection and severe illness than the earlier data from the preprint did. Now, how does this compare to other countries? Decline in immunity in the UK. This is from this paper here, more of a government publication really than a paper. Over 8 million people in the UK received COVID-19 booster jabs. So this was released by the government on the 1st of November, so 3 days ago. And it gives the full information there, which I'm just going to summarise. And we do find that basically on the whole, it is pretty consistent so far for what we have, pretty consistent with the Israeli data. So I think this is getting down to something which is fundamental about epidemiology because of the consistency between the UK and the Israeli data. So decline in immunity in the UK. Now, disappointing. Protection against symptomatic disease. Okay, symptomatic disease, not severe disease, symptomatic disease. Oxford AstraZeneca vaccine, 65% after 3 months, 45% after 6 months compared to someone who has had no vaccine at all. Quite a big decline, 65 to 45% in that subsequent 3 months. I must say it's a disappointing result. No two ways around that. It's disappointing. The Pfizer is better. 90% in the up to 3 months after the second dose, 65% after the second dose. So, 65% after 6 months after 2 doses. So, with the Oxford one, that was 65%, and that was 45%. So we see that the Pfizer vaccine is considerably outperforming in terms of protection against symptomatic disease, the Oxford AstraZeneca vaccine. Not a salesman for Pfizer, this is just what the data is saying. And it's disappointing because the Pfizer is also a lot more expensive, unfortunately, but there you go, this is what the science is telling us. Now, protection against hospitalisation. Oxford AstraZeneca, 95% protection at 3 months, down to 75% protection at 6 months. Now, this, of course, is much more concerning than the symptomatic disease. But someone who's had 2 doses of the Oxford AstraZeneca vaccine only has 75% more protection than someone who's had no vaccine at all at 6 months. Lot better than nothing, of course, lot better than nothing, but still disappointing. To me, disappointing. Pfizer protection against hospitalisation after 2 doses, 99% at 3 months, brilliant. 90% at 6 months. So again, we notice that the equivalent figures there for the Oxford would be 95 and 75%. So again, I'm afraid we see the Pfizer vaccine outcompeting the Oxford AstraZeneca vaccine in terms of protection against hospitalisation. But we do still see this reduction, which is why the booster doses are being rolled out. So that's that publication there. Do check it out. I put the links in for these, of course. All the data's there. Make sure I am getting it right, which I was careful to make sure I am, of course. Right. Now, what's this? Early UK booster results from Pfizer. Yeah. So the booster results aren't really in from the UK yet, but the booster doses are conferring protection back up to where it was, back up to 95.6%. So 95% from the Israeli data, 95.6% from the UK data. These are the same. This is excellent. So the booster is protecting back up to 95.6 against symptomatic infection after the booster dose. How much it's protecting against hospitalisation in the UK at the moment, we don't yet have data for. This is from the government 3 days ago. This is all we have. But given that it's protecting against symptomatic infection, it's reasonable to assume that it will increase protection against hospitalisation as well, exactly as it did in the Israeli situation. I've no question at all that will transpire to be the case. Now, the booster situation in the UK at the moment, we've given 8,115,229 boosters so far, available on the NHS to people most at risk of COVID-19 who've had the second dose at least 6 months ago. If they're in a particularly high risk group, they can have it after 5 months. And at the moment in the UK, this includes aged over 50, frontline healthcare workers, 16 and over with a health condition, 16 and over who are carers or live with a vulnerable person, immunosuppressed person, for example, and pregnant women in eligible groups can also get the booster dose. COVID-19 booster vaccines and flu vaccines, direct quote from the government website. If you're offered both vaccines, it's safe to have them at the same time in different arms, of course. So I'm afraid this is disappointing. We are seeing these reductions, precisely the numbers that we've given, in protection against infection, and more importantly, the smaller decline against severe disease, which is what we're seeing, and the booster doses are going to dramatically alter that, potentially for quite a long period of time. So I'm afraid it's not what I wanted, but it's that's what the science is showing. That so personally, I'm down for my booster dose. I've got it booked for about 2 weeks, 2 weeks time, a fortnight on Saturday. I think mine is booked. So I'm completely convinced by the evidence. Now, just to finish, the 2 vaccine regime is giving a lot of protection already. So these are from the United States. Age-adjusted rates of COVID-19 associated hospitalisation by vaccine states in the United States. So greater than 18 years of old, greater than 18 years of age, January to August 2021, and these are the rates for people that are fully vaccinated in green. And on the same linear scale, there we see the linear scale. It's not fiddled. Quite a difference for unvaccinated people. So unvaccinated people getting hospitalised at a far higher rate than the fully vaccinated people. That's pretty convincing. I think I've got one more chart here. Now, this is in a particular age group, 18 to 49 years of age. Now, the reason I put this on is, of course, is we're going to talk about, I'm not going to do it on this video because we're a bit long already, but the vaccines, of course, in the States have now been approved for, Centers for Disease Control have approved 5 to 11-year-olds. So there is some interesting things to talk about that. I'm going to do it as a separate video. I've started to prepare that already. But the youngest age group we have data for in the States is the 18 to 49-year-old age group. So fully vaccinated people hospitalised, unvaccinated people hospitalised. There's no real question mark about the magnitude of protection against hospitalisation from 2 doses of the vaccine. And of course the reason that these are recommended in this age group is that they are saying that the risks of COVID-19 are greater than the risks from vaccination. So yeah, disappointing video, but there we go. It means a lot of us, in Western countries at least, will be called for a booster dose at some point. Earlier if you're older in a high risk group, perhaps into wintertime if you're in the younger age group, and as we've seen in Israel, already young people being vaccinated with a 3rd booster dose. So there we are, and I'm just hoping that this will generate enough herd immunity to fulfil what I'm still hoping is a great reduction in cases and hospitalisations as of early 2022. Thanks for watching.